Lucy back. She's been on vacation for a while as far as doing her job on Facebook, so we got her back today. I hope you guys are having a fantastic day. And I wanted to speak with you today about pet preventative medicine. The reason I wanted to bring it up is it's an ongoing controversy that's existed at least as long as I've been a veterinarian, and probably longer than that. And there's some recent studies out there that a lot of people are questioning, in the sense of looking at those studies and trying to figure out what the right thing to do with preventative medicine is. So what I'd like to focus on today mostly is the things that you would see your veterinarian for, and the things that you might wonder about whether you're getting value about or with. So the two things that I'm going to focus on mostly are small animal preventative medicine things that have to do with vaccines and parasite control. And I'll try to give you a little perspective, so bear with me, I will try to make some points. But the perspective that I would give is the first of the vaccine controversies that I was aware of came up in cats, and that started to become apparent in about 1990, about the time that I graduated vet school and became a veterinarian. And the concern was that in kitties there were some vaccines that were positively linked to the induction of cancer, so that you would vaccinate for rabies with a particular technology of rabies vaccine or with feline leukemia virus. And there were a small percentage, studies would say somewhere between 1 in 10,000 to 1 in 100,000, depending on which study you looked at, that would develop a very severe disease that would either cost their life or sometimes cost a leg if you put it in a place where you could amputate the body part to cure cancer. And of course that's a horrible thing to have happen. People have seen some of the same things with influenza vaccines and other things that they've dealt with in the human healthcare field. So there is obviously a concern about what is good preventative medicine. And I've tried to bring you in previous segments what I believe is totally the truth. And when I believe it's the truth, I will say it that way. What I want you to understand is today, this is Doc Silkman doing a little editorializing. I don't know exactly what the truth is. I've tried to find it, and every time I look for it and I believe I've got it, I see some conflicting information that makes me question which direction to go. So for the purpose of today's discussion, there is a study that's recently circulated, and several of my clients and some of you who follow Lucy and follow us on these presentations have messaged me about, well, there appears to be a study out there that suggests that the immunity for things that we vaccinate pets for might last 5 years, might last 7 years, might last longer than that. So why do I vaccinate my pets on shorter intervals than that? Is this basically just a revenue-producing thing from the veterinary profession? And I think, unfortunately, probably in some circumstances that is the case. There is certainly evidence in this profession, like there is in other professions, that sometimes it's convenient to do preventative medicine that has no value. And so, again, we've tried to sort through some of that. So why would I talk with you about this? Well, the concerns, I guess, that I have for you as pet-owning clients and followers is something that I've seen pretty much all my career, and I will give you two diseases to kind of illustrate what I think some of the positives and negatives are. When I first started the profession, as I said, there was certainly a substantial controversy and concern about giving feline leukemia virus and the possibility of induction of cancers. Yet every spring and every fall our isolation ward was full of leukemia cats and parvovirus dogs. Today we almost never see a leukemia positive cat, but we still continue to see parvo positive dogs even though we vaccinate for both. Well, why is that the case? Part of it has to do with the disease. Leukemia is a very fragile virus. It needs to be either in a kitty or in some body secretions before they dry out to survive. And so out in the environment, leukemia virus doesn't last very well, which brings us to what is vaccine principle. Well, vaccine principle is never that you're going to have a 100% safe vaccine. That does not exist. There are definitely, for proponents of not vaccinating. There's evidence, and lots of evidence out there, that certain vaccines, in fact probably all vaccines, can cause some undesirable effects in some individuals. I've just illustrated the point with the cancer induction in the leukemia vaccine for the cats. On the other side of the equation, if you're able to successfully surround a susceptible individual that either didn't get vaccinated or that was a patient that didn't respond to the vaccine, and there are certainly plenty of those out there where we give a vaccine but we don't get immunization. But if you're able to take that one individual and surround them with a group of individuals that are immune to disease, you break the disease chain. And so for feline leukemia virus, we've been very successful at doing that. In the human field, for smallpox virus, we've been successful at doing that. For whooping cough, for other things that we thought we did not have any problem with, that we thought were eradicated from the world, and we quit vaccinating, those diseases have started to come back again. So that is a principle to kind of keep in mind, is what happens when you don't do preventative medicine, and I'll illustrate a few points a little later about that. So what's the difference between feline leukemia, which we've been able to, I would say at least in my clientele and probably in the North American continent, where immunizations are probably done a little more proactively than in some of the developing countries, we have seen probably nearly a total absence of feline leukemia virus these days. So why does it not work for parvo? Because we vaccinate puppies, or try to vaccinate puppies, the same way as we do cats. But parvo, which is also feline distemper, so the cats get the same type of problem, parvo unfortunately is a very resistant virus. It has a thick coat. It can survive out in the environment waiting for some susceptible host to find it out in the grass or in shaded areas along your house. It can survive for several years. So in a dog, unvaccinated, I would say there's an extremely high likelihood, I don't know if it's 100%, because there are very few 100% in medicine, but an extremely high likelihood that if you don't practice good preventative medicine, at least early in your dog's life, you're going to deal with the effects of trying to treat your pet through parvovirus. And even though the vaccine works, every group of individuals that's newly born is going to get a little immunity from mom's colostrum, like all of us mammals get if we take mom's nursing milk. That colostral immunity is going to wear off, and then until we acquire our own immunity, we're going to be susceptible to disease. So the principle is, the way my clients hear from me what good preventative medicine is, well, how likely is your pet to get disease if we don't vaccinate, and what is going to be the consequence of your pet getting that disease, both financially, emotionally, the potential of survival, how difficult is it going to be to cure the problem. And so I know, and most of us as veterinarians know, when your pet gets an immunity to parvo, probably if you do several puppy vaccines and then a couple early in life, whether the immunity lasts lifelong from the vaccine or not, your pet is going to go out to dog parks and other places, and it's going to get reacquainted and re-exposed to parvovirus, just like you and I, once we get immunity, are still exposed to measles or mumps or other things, but we don't get sick because we've got an immunity that protects us. So probably if there was a way to give the other vaccines that pets have, and a combination of distemper and hepatitis and other kinds of things that we probably should continue to vaccinate for, and take parvo out of that vaccine, I don't see probably a reason to vaccinate most dogs. There are a few susceptible breeds, like if you have a Dobie or a Rottie or a Bull Terrier, those breeds seem to be maybe a little more susceptible and don't acquire the same immunity that a lot of breeds do. But if you take those dogs out of the equation, and that's another factor to determine if you're a pet owner whether you should be more aggressive or less aggressive with your vaccines. But if you take those genetically different individuals out of the equation, probably parvovirus would not need to be reintroduced into the vaccine protocol in any pet that's after 3 years old. There are other viruses like canine distemper, like the new mutated flu viruses, where the immunity is not going to be broad as far as the pet population, and they're new diseases, so that there are not a lot of exposure that we've had out there to try to get that group of immune individuals surrounding a susceptible one, and so I recommend doing immunizations there. I don't recommend doing vaccinations for Lyme's because I'm here in Utah. Unless I have a client that has a summer home, or if you will, a winter home in South Carolina or along the eastern seaboard, and if I practiced in New Jersey or Pennsylvania or Virginia, I would certainly recommend Lyme's vaccination. I also don't see a lot of heartworm disease in Utah, but in cats, if they get heartworm disease, you have no treatment option. You have to try to help the cat owner keep the cat alive without giving the preventatives, or the curative medications, because cats cannot take the arsenic derivatives that we use to kill heartworm disease. Dogs can, but it's toxic and expensive and difficult to do. And so, because it's mosquito transmitted, all your pet has to do is find the mosquito who's picked up the heartworm disease from one of the wild canines that we don't vaccinate, because all of that wild canine family, coyotes, bears, foxes, wolves, can support heartworm disease. And even more importantly, there's another benefit from doing monthly heartworm preventative, and that's getting rid of intestinal parasites. And just by illustration of Lucy, who I just turned loose, Lucy came from a very reputable breeder, but the first time we dewormed her, she had tons and tons and tons of roundworms that came out of her system. Well, if you do heartworm preventative, every month you're giving your pet something that will get rid of intestinal parasites as well. What is the concern about intestinal parasites? Well, your pet can have a lot of diseases from them. They don't stay in the intestinal tract. They eat their way through lungs and liver and kidneys before they go back to the intestine. There was a few years ago a little child in Park City because he got exposed to the parasites, and they can migrate right through the skin, and they're microscopic. So if your dog comes in and has a few stuck under their bottom after they just went to the bathroom and jumps up on your couch or your pillow and you lay down, I won't get too graphic, but there's a lot of ways you can get exposed to intestinal parasites that you don't know about. Anyway, getting back to the child in Park City, one of those parasites migrated into his eye, and so this child and his parents have a huge issue that has to do with, I don't know if it was a lack of preventative medicine, I don't know the whole circumstances to the case, but anyway, there are diseases out there that we can pick up from our pets. Rabies is obviously one of those. Intestinal parasites is another one. So, what am I getting to, and what is the point, and what I hope is the benefit of this discussion to you as someone who's trying to make the right decisions for your pet? Well, first off, the studies that are recently out there about long-term immunity, yes, that does appear to be a valid study, and yet there are other studies out there where you take different groups of dogs and pets and different individuals, and you go a year or two or three past what the vaccine has been licensed to do, and 30 to 40 to 50% of those pets that are challenged with the disease will get the disease. So, again, this is me editorializing, but I made a pretty good career out of trying to be a proponent for the best that I can do to preserve the pet and owner's relationship at the least cost. Do I and have I seen pets that probably got diseases from the vaccines that either myself or one of my colleagues administered? Absolutely, and that's always a disheartening experience. But for every one of those pets, I've seen at least 100 to 1,000 that pet owners have to make a decision about whether to euthanize their pet or whether to try to come up with hundreds to thousands of dollars to treat things like parvovirus, things like heartworm disease, that they could have prevented very quickly and very easily. And if you take a look at the devastation, I guess I'll use that verb, if you take a look at the devastation that happens as a consequence of over preventative medicine and compare that to the devastation that happens from the consequence of under preventative medicine, I think there's a very clear understanding of how you benefit the pet and how you benefit the owner. Now, does that mean that we do not try to keep up with good technology? No, every 3-year vaccine that is available that we believe needs to be given in this locale, we try to do a 3-year vaccine. In the ones that are a shorter immunity, we give it at the level that the vaccine manufacturer has got it licensed for, and we are conscious and we know that in most pets probably that immunity is going to last longer. But again, there are some pets that you immunize or that you vaccinate and you don't get immunized at least one time. Maybe you'll get them immunized later. Maybe there was something that was going on inside their body that prevented that from happening. There will be other circumstances that are difficult to tell. And so alternatives that are out there, some of the protagonists for not doing vaccines will say, well, what about antibody titers? And again, there are studies out there that will suggest that yes, you can measure antibody titers, and yes, you can get some information about what your pet is doing and what your immunity or what his level or her level of immunity is to a certain disease. There are also studies out there that will suggest just measuring antibody titer is not sufficient to really know whether the immune system is adequate to protect your pet from disease. It's very difficult to measure responses in T cells and other kinds of immune functions. Very easy to measure antibody levels. Again, the expense is substantially more than doing the preventative, but for some pets who don't tolerate vaccines well, and when we see those, if they have a bad reaction to a certain vaccine, we talk about ways to try to make sure that we don't over-immunize them. And again, what I hope we do is try to take a look at everything that is out there, and bottom line, try to make the best decisions, and hopefully your veterinarian or you with this information can try to make your best decision about not necessarily being totally black or totally white on one side or the other, but first off, what are the diseases in your area? As I mentioned, Lyme's disease is kind of pretty predominant eastern seaboard disease problem in this country. It can exist a few other places. Heartworm disease is a lot more prominent in the south because it's mosquito transmitted. Intestinal parasites, things like the roundworms that we mentioned, those eggs can last 6 to 7 years in any condition we know on the planet, waiting for a susceptible individual to find them. And so I think when you look at preventative medicine, you should make, if you're a veterinarian or a pet owner, you should make hopefully some intelligent decisions about the risk of doing preventative medicine and the risk of not doing it. And that has to do not only with what happens with your pet, it has to do with your own personal situation and your own personal financial situation. Again, unfortunately, I've seen pets who have been euthanized for diseases that I could have easily prevented because, well, for example, a pet parvo treatment, if you have to hospitalize them and take them through 3 to 5 days worth of intensive fluid therapy and other things to keep them alive, the cost of doing that is going to far exceed a whole lifetime worth of doing immunizations. So again, my job as I see it is to try to do the best that I can to try to maintain the best relationship that I can between the pet and the owner with the least emotional, physiologic, and financial turmoil that I can. So I hope this editorial is beneficial to you. I hope if you had questions about how to do preventative medicine, it helps clear things. Is there an absolute right or wrong? No, unfortunately, there is not an absolute right or wrong, but I would say, again, when you look at certain diseases, like in the human field, at one point in time, whooping cough was a common vaccine. We thought the disease was gone and we quit vaccinating for it. Maybe that was appropriate, but we're seeing whooping cough come back. At one time, smallpox appeared to be eradicated from the earth, and now there are instances where it's back again. Does that mean that I think everybody needs a vaccine? No, but I think if you're in a particular area and they have concerns about what's happening there, that you need to make some decisions based on, one, what's going to happen with your pet, two, what the disease processes are in your area, and three, can I, as a pet owner or as a pet owner, deal with the effects of trying to treat disease, and both financially, emotionally, and sometimes physically put the effort into doing that? Or do I want to try to deal with the effects of preventing disease, understanding that that's not a perfect world and it never will be a perfect world? So again, I hope I've been useful to you. I hope you guys are having a wonderful day. And Lucy and I will get back on when we have something else that we believe is valuable to share with you.